Hello, everyone. My name is Valerie Manu. Welcome to today's webinar on the Department of Labor and Industry Workplace Standards. Before we get started, I'd like to go over a few items so you know how to participate in today's event. When you join today's webinar, you selected to join either by phone call or computer audio. If for any reason you would like to change your selection, you can do so by accessing your audio pane in your control panel. This webinar is being recorded. We will share the recording and PowerPoint with webinar registrants after this session. Our participants are placed on mute for quality assurance. You will have the opportunity to submit text questions to today's presenters by typing your questions into the questions pane of the control panel. You may send your questions in at any time. We will collect these and address them during the Q&A sessions throughout and at the end of today's presentation. And now I'll turn it over to Kathy Glazer, VCF President.
Thanks very much, Valerie, and welcome to everybody this afternoon. We are glad to have a chance to provide some information about the new workplace standards that are in place now through the Virginia Department of Labor, and really appreciate that they are able to provide someone who can give industry-specific advice today for the childcare industry. And so we look forward to having a presentation from Jennifer Rose, and then also we'll have plenty of time for question and answer. We've also invited Jenna Conway to be on the call today in case questions come up about how the workplace regulations may or may not sort of interface or interact with the regulations and guidance from the Department of Social Services, Department of Education, and from the governor's office. But first, we are pleased to welcome Megan Healy, the governor's chief workforce advisor, to give us a few opening comments. Megan, thanks for joining us, and I'll turn it to you.
Thank you so much, Kathy, and thanks for having me on the call. I'm going to be briefly here because I want to thank everyone on this call for all that you do. And I know during COVID-19, it's been even more stress with not really knowing about health outcomes and problems and workplace safety, and making sure our children are safe in the environment as well as your workers. And that's really what my job is as chief workforce advisor, is oversee all workforce development, but also workers. And that's workers that are looking for jobs, workers that are on the job, and also many workers that we've seen during COVID-19 been dislocated or unemployed during this time. And so I know it's a crisis situation. It's been very, very stressful. So I want to thank everyone on this call. Many of you might know, or some of you, that I do also have a 3-year-old. And so I think it was every Friday during COVID-19, I would kind of creep into my child. I always feel like bad news is on Fridays for some reason. I thought it was Fridays that I would get that notice that my child development center would be closed, and I would have to find childcare. And thank goodness I was one of the lucky parents that did not have that situation. But seeing the protocols and the extra effort needed to make sure that the child development center was safe was important to me as a parent, but also really important to my child. But they did a fantastic job and continue to do so. So I know kind of what you have been peeking in to see. We can't go in the buildings, but knowing all the hard work. And so really where these emergency temporary standards for workplace safety came around COVID-19 was that my office, Jennifer Rose, who's done a fantastic job working on these issues at the Department of Labor and Industry. I think she's not sleeping ever since COVID started. We've received thousands of complaints from workers that felt they were not safe and go in the workplace. The governor, we've had multiple questions, concerns, thousands of emails to my office as well around these issues, and we knew we had to do something. So Virginia was the first to have such standards implemented. The emergency temporary standards that do last 6 months around specific of COVID-19. And really what these standards are is to make sure that workers do feel safe in their environment. And so it was a Biosafety and Health Codes Board that presented these and passed these regulations. And then there's constant public comment going on now about how these standards might become permanent. But really what I want to say today is that Department of Labor is here to be supportive and to be your friend. Really that we hope everyone is compliant with these regs, and that the state agency will do anything they can to help support that. We know that and make it as easy as possible. We know they're working closely, also Department of Labor and Industry, working closely with Virginia Department of Health. I think they meet once a week on looking at these workplace safety issues, which I think has been really, really important, specifically around enforcement. But I just really want to say that they are friends and work with many businesses, because I know businesses want to do the right thing, especially in your business when you want to protect the children that you see. It is really, really important. So I appreciate all your hard work. I know there's extra effort to make sure our children are safe, but I think it's well worth it. And I really just want to thank you for all the hard work that you guys do every single day to making sure our children are learning and are safe. So thank you very much.
Thank you, Megan. We appreciate you joining us this afternoon, and appreciate that sort of overarching context for how these standards were developed and what the goal and purpose is. So I think now we'll turn to our speaker, Jennifer Rose, and we'll just let you know that Jennifer is are you ready for this? Virginia Occupational Safety and Health Administration Cooperative Programs Director at the Virginia Department of Labor and Industry. And that is quite a title, but her job title today is to be an informant to let you all know about the impact and implications for childcare businesses from this emergency standard. And we're really grateful to you, Jennifer, for bringing the information today and for being willing to answer some questions afterward. So with that, we'll ask you to get started on your presentation. Very much welcome you.
Thank you for having me. Good afternoon, everyone. Again, my name is Jennifer Rose, and I'm the Cooperative Programs Director with VOSH, which is under the Department of Labor and Industry. And today I'm going to be talking about the new Emergency Temporary Standard on Infectious Disease Prevention. There in the left-hand corner, you can see the code number, the state code number. If you're interested in seeing that text, that's how it is referenced. We also have that available on our webpage. Next slide. Here's my contact information. Email is probably the best way to reach me since I'm hardly ever in the office. And again, Cooperative Programs Director. And what that includes is not only our free consultation service, but our volunteer protection program, which is our recognition program to recognize exemplary employers in the state. Next slide. So why develop a standard and who it applies to? Sole purpose is prevent the spread of the SARS virus and COVID-19. The standard applies to every place of employment within the jurisdiction of the VOSH program. And this is basically anyone that has one or more employees. I had a request to make sure that I specified that religious organizations are covered under the standard for those that provide secular activities such as childcare. The Section D10 of the standard, Section D10 of the standard states that the emergency temporary standard is designed to supplement and enhance existing VOSH laws applicable directly or indirectly to COVID-19 hazards. These are such as, but not limited to, personal protective equipment, respiratory protection, sanitation, access to employee exposure and medical records, occupational exposure to hazardous chemicals in laboratories, and hazard communication. The Emergency Temporary Standard takes a layered approach to providing employee protection against COVID-19 hazards and job tasks depending on exposure risk level. There are minimum requirements that apply to all employers, and there are additional enhanced requirements for medium, high, and high risk category employees. Next slide. So what we're going to talk about today is how the standard guides employers to protect their employees and actions that they can take to prevent the spread of COVID-19. Next slide. Some of the basic overall protections that should be in place. The employer should require social distancing at all times. And obviously everyone knows from the news that this is a distance of 6 feet from one another. Employers are encouraged to have employees self-monitor. Basically, they should be looking for symptoms. If they're sick, they should stay home. Employers should be posting signs at the site informing employees to immediately report any symptoms and other pertinent information to their infectious disease prevention plan. Employees should make sure that employees understand when personal protective equipment is required and used properly. One thing I'll get into in the standard is talking about face coverings versus masks. And face coverings, such as the cloth coverings you see typically everyone wearing around in the public, are not considered masks per the definition of the standard. But this does not discourage the use of face coverings. The standard actually does provide for the use of those. Employers should be providing access to hand sanitizers and soap and water. They should also have a routine and consistent cleaning and disinfecting schedule. Employees should be trained on all the elements of the plan and what protections are in place at the job site. Next slide. As I mentioned, there are 4 exposure risk levels, and I'll basically just be talking today about those medium exposure risk level jobs. And medium exposure are job tasks that require more than minimal occupational contact inside 6 feet with other employees, other persons, or the general public that may be but are not known or suspected to be infected with COVID-19. These may include but are not limited to waiters, grocery store workers, agricultural workers, construction workers, manufacturing workers, healthcare workers in settings without known or suspected sources, and of course, those in the childcare industry. Next slide. So when employers first start this process, they need to determine their exposure risk level. So how do we determine that childcare tasks are in that medium exposure risk level? Several factors should be involved in determining the risk level. First, you want to look at the job tasks that the employees are doing. Is it an office setting? Are you having interaction with the public? Is it manufacturing? Or do you even have employees that are teleworking that are not in the work environment? You want to look at the presence of the virus. Have you had previous outbreaks at your site, or do you have a high absentee rate? All these things should be factored into that exposure risk level. You want to look at the number of employees and the size or the area of the workplace. Do you have close quarters, or are employees allowed to spread out and have room to not be in such a concentrated area? And you want to look at the duration and frequency of exposure. If you have employees that are working different shifts, or you can change shifts, and then also any hazards encountered, things like contaminated surfaces or any airborne transmissions that may be present in the workplace. All these factors should go into determining that exposure risk level. Next slide. So very high, or medium exposure risk level employees must be trained on the hazards and characteristics of the virus and COVID-19 disease. The employer should enable each employee to recognize the hazards of the virus and any signs and symptoms of the disease. Employers should also train their employees on the procedures that they must follow in order to minimize these hazards. This training shall include the requirements of the standard, any characteristics and methods of the spread of the virus, any risk factors such as pre-existing medical conditions, inform employees about the awareness of transmission and how the virus is transmitted from one to another. Safe and health work practices. These would include things like social distancing, disinfecting surfaces, non-contact methods of greeting, things like that. And personal protective equipment. Employees need to be trained on when it's required, what exactly is required, how to put it on, how to put it off, how to adjust personal protective equipment, as well as any limitation exceptions. One of the things with this is you wanted to make sure that employees are aware of the limitations of face coverings as opposed to the mask and or respirators. Obviously, they do not provide the same amount of protection from the viruses. One other thing that the standard covers is an anti-discrimination policy. Basically, what this talks about is that employers can't discriminate against employees who express their concerns about their health or safety in the workplace. This is not anything new to VOSH standards. We do have anti-discrimination standards or portions of the standard where we have a whistleblower program where employees, if they feel that they have been discriminated against for bringing up safety or health concerns, there are repercussions for the employer. And then lastly, the standard talks about the requirement for having an infectious disease preparedness and response plan. And we'll go into detail on that when we get into the requirements at the end of the standard. So the next slide. Some of the items that are talked about in the standard as requirements include things like sick leave, teleworking, staggered shifts. We also talk about the Families First Coronavirus Response Act. And while this is not enforced by VOSH, we do make sure that employees are aware of that, and this provides that paid sick leave related to the coronavirus and COVID-19. Employees should be provided policy and procedures on self-reporting and monitoring, how they go about reporting any positive test results to the employer, and how the employer is going to notify other employees of any positive tests. Another important aspect is the return to work procedure. Basically, this talks about how through the process of not only of employers opening back up their doors, but also if you have employees that may have been exposed and have been in quarantine, how are you going to safely return them to the workforce? One of the things that I'll point out with the notification of positive tests, the standard does require that building and facility owners must notify all their employer tenants in the building when there are one or more cases on the floor or work area where the case was located. The identity of the individual will be kept confidential in accordance with the requirements of ADA and in the other federal or Virginia state laws. Next slide. So one of the important aspects of doing that hazard exposure risk level is determination of PPE hazard assessment. And this is the same process that any employer would use in any work site when looking at personal protective equipment, including face masks and/or respirators. The first step is to assess the hazards. Again, looking at each of the job tasks your employees are exposed to, looking at what hazards may be presented in the workplace, and then determining what engineering controls, administrative controls, or PPE as a last resort. Next slide. 7 steps to performing that PPE hazard assessment. Step 1 is to inform any affected employees of the process. The employer should inform the affected employees in the work area that it's being assessed, and they will be involved in the process. The employer should discuss the reasons for this survey and the procedures being used for the assessment. In doing the assessment of the work site, the employer should review any job procedures, potential hazards, and any PPE that are currently in use. Second step is to review data. The employer should look at any reports of work-related illnesses. Have there been employees in the site that have been exposed to the virus and/or have COVID-19? All this data should be incorporated into performing that PPE hazard assessment. Step 3 is conduct a thorough work survey. The purpose of the survey is to identify any sources of hazards to employees. Employers should be observing the layout of the workplace, where employees are located in that workplace, what operations are going on, and any hazards or places where PPE is currently being used and for what reason. Step 4 is to determine the hazard risk level. Using the definitions that I talked about, we have the very high exposure risk level, which is typically you only see in the medical field when they're doing things that would generate aerosol versions of the virus. We also have the high exposure risk level, and these are jobs that have high potential for exposure inside 6 feet to known or suspected sources of COVID-19. And again, you're typically going to see this in the healthcare industry. And then a reminder, those medium exposure risk levels, which typically the daycare and childcare providers fall into this category, are jobs that require more than minimal occupational contact inside 6 feet with those who may be infected with the virus but are not known or suspected to be. Again, examples of this include schools, any high population density work environments, things like poultry, food processing, manufacturing, as well as any high volume customer facing retail settings, things like grocery stores, restaurants, bars. And then lastly, there is a lower exposure risk level, which lists jobs that do not require contact inside 6 feet with persons known to be or suspected of being or who may be infected with the virus. These would include things like employees that telework, any office workers who do not have contact within 6 feet with the public or other coworkers, and any manufacturing or industrial facility workers who do not have contact within inside 6 feet. Next slide, we'll look at the hazard assessment. And this assessment is required as part of the standard to be conducted in writing. This template is available on our webpage for download and filling out. Again, you'll see kind of guides you through the steps that I've talked about so far is writing a description of the hazard. What are your employees doing that would put them in potential exposure to the virus? What engineering or administrative controls do you have in place? Are there things like physical barriers, separating workstations, any administrative controls, things like shift changes or various controls that would be provided first before PPE is required. And then based on this hazard assessment, the employer is required to classify themselves in these 4 categories. If you go back one slide, I'll continue with the steps of the hazard assessment. Step 5 we talked about was determining what controls that are in place. Obviously, those engineering or administrative controls, and then lastly, PPE. You do want to make sure that this written hazard assessment is available in your workplace. It has to be available to employees for them to see, as well as any regulators that may come in and look at those. The assessment has to be signed and dated by the person performing the assessment, and it may be stored either electronically or as a hard copy, as long as employees have access to that. And then lastly, you want to make sure that you reassess the workplace as necessary. Do you have any new equipment or processes or any new job tasks that your employees may be doing? Have you had any employees that have been exposed to the virus or have COVID-19? And then suitability of any selected PPE or face coverings. Next slide. Some of the engineering controls that we'll talk about is social distancing first. The standard it refers to this as physical distancing, so you'll see me use the terms interchangeably. So next slide. Physical distancing requirements. The employer must ensure that employees observe physical distancing at all times on the employer's property, including policies and procedures that either use verbal announcements, signage, or visual cues to promote physical distancing. You can look at decreasing worksite density by limiting non-employee access to the place of employment or restricting access to only certain workplaces in order to reduce employee exposure. Physical distancing, you also want to consider things like common areas or break rooms to consider whether or not they should be closed or controlled occupancy. Some of the common areas that you need to consider are things like again, break rooms, lunch rooms, and you want to factor in any cleaning and disinfecting in that immediate area where the employees will be located. Next slide. One of the requirements in the standard is that a posting must be placed in those common areas, reminding employees about the controls that they have to follow, as well as any physical distancing requirements. 4 things are required on that entrance posting. The first is the occupancy of the space. Again, this is depending on how big your space is, how many employees can safely be in there and still maintain that 6-foot physical distance. You also want to look at hand washing or hand sanitizing. Based on what you've provided in your workplace, you need to encourage employees and remind them of the importance of sanitizing their hands. And then on the physical distancing posting requirement is the cleaning and disinfecting of shared surfaces. You need to develop some sort of process for employees to clean and disinfect the shared surfaces or have some sort of regular cleaning process in place. Next slide. When we just talk about cleaning and disinfecting, you want to look at high touch areas. These would include things like light switches, door handles, stair rails. If you have any vending machines in the common areas, anything where several employees could be potentially touching the same area. As far as cleaning and disinfecting these areas, the EPA has developed a written or a web page that lists all the disinfectants that can successfully be used against the SARS virus. So I encourage you to check out that web page. It does list specific manufacturers. Obviously, you'll see a lot of Clorox brand products on there and Lysol as well. Next slide. The last part of the requirement talks about the infectious disease preparedness and response plan. Employers in exposure risk levels of very high and high must develop and implement a written infectious disease preparedness and response plan. Medium risk employees with 11 or more employees shall develop and implement a written infectious disease preparedness and response plan as well. Employers shall designate a person to be responsible for implementing their plan. And our webpage, which I'll talk about again later at the end, we do have a template for an infectious disease preparedness response plan. Basically, what the employer does is go through that hazard assessment, determine their exposure level, and then decide on what those engineering, administrative, and PPE controls that are in place, and basically just fill it out based on what your employees are expected to do at that site. Next slide. The plan must contain the name or titles of the person responsible for administering this plan. This person should be knowledgeable of basic infection control procedures as well as job tasks that are being performed in the workplace. It should provide for employee involvement in developing and implementing the plan. Just like with the hazard assessments, you do want to make sure that you include employees in the development of this, just because they do have an intimate day-to-day knowledge with the job tasks that are being performed. You also want to consider and address any risk level associated hazards with the various places of employment or job tasks at the site. Next slide. The written plan must include where, how, and what are the sources of the virus or COVID-19 that employees might be exposed to at work. These could include the general public, customers, other employees, patients in a medical setting, or other persons that may be present in your work site. Known or suspected to be infected persons for those high risk levels, again, in medical areas that we see. And also, you want to look at things like contractors. If you have contractors working on your site, they would need to be included in your plan, as well as any children, the public, things like that, that would employees, in addition to employees that would be present in your site. Next slide. Plan should also consider contingency plans for situations that may arise as a result of outbreaks in your site. If you're going to have an increased rate of employee absenteeism, you need to look at how you're going to cover the shifts with employees and possibly doing downsizing operations and dealing with that, or the need for physical distancing based on how many employees that you have. You also want to look at any elimination or substitution or engineering controls and work practice controls that may be in place at your work site. Some options for conducting essential operations with a reduced workplace. This contingency plan obviously should worst case scenario, look at if you had a case where you had employees that were not present or not able to come to work because of having COVID-19 or being exposed to that. Next slide. The plan must also identify basic prevention measures that must be implemented at your site. Again, you want to promote frequent and thorough hand washing, including not only by employees, but customers, visitors, and the general public that may be coming into your place of employment. If soap and water, running water are not immediately available, the employer is required to provide hand sanitizer. The plan should also contain elements of maintaining a regular housekeeping practice, how you're going to disinfect those surfaces in your workplace. This could include routine cleaning of surfaces, equipment, and other elements of the work environment. The plan must also establish policies and procedures for managing and educating visitors to the place of employment. So not only are the employees required to be trained, but you need to provide some sort of basic information to visitors to let them know what your policy and procedures are at your workplace. Next slide. The infectious disease preparedness and response plan must provide for the prompt identification and isolation of known or suspected to be infected with the virus employees when they are exposed away from work. These should include procedures for employees to report when they're experiencing symptoms of COVID-19. The plan should address infectious disease preparedness and response with outside businesses. And again, this could be including things like subcontractors, businesses that provide temporary employees. All of these should be included as a factor when looking at controls that are in your workplace. And these then would need to be documented through that disease preparedness and response plan. Next slide. And the last requirement in the infectious disease preparedness plan that's required by the standard is that the employer must identify any mandatory or non-mandatory recommendations that they're following from the CDC guidelines. The standard does allow for employers to follow CDC guidelines in lieu of the provisions of the standard, assuming that they are, up to date. And basically, if the employer is going this option, they are required to provide to any inspectors or any employees providing documentation of what CDC guidelines they are following. We actually put this into the standard, luckily, because shortly after the emergency temporary standard was put into place, the CDC did change their guidelines about traveling by air, and since then they've changed a couple of guidance regarding quarantining and things like that. So you also want to make sure that the plan ensures compliance with any mandatory requirements of any applicable Virginia executive orders or orders of public health emergency related to the SARS virus. So this standard does not trump any executive orders issued by the governor. The standard basically just says that you have to be in compliance in addition with those mandatory executive orders. Next slide. So important dates that are included in the standard, and the standard did take effect on July 27th, 2020, when it was published in the Richmond Times-Dispatch, as well as being provided on our webpage. These are both requirements whenever an agency implements a new standard. The requirements for employee training in Section 80 of the standard will take effect on August 26, 2020. So again, that date has passed, but employers were given 30 days to make sure that they provide that training to those employees in the very high, and medium risk categories. The lower risk categories are exempt from providing that training, with exception to just providing a basic written or oral information page to the employees on how they can minimize exposure to the virus. The other important date is the date for the infectious disease preparedness and response plan. Again, this date has passed. Employees were given 60 days to develop and implement that written plan, and then train your employees on that plan. Again, that August 26th date gave an exception for training your employees on the written plan, because obviously it didn't have to be developed until September. So that September 25th date, employees do need to be trained on the standards or on the elements of the new plan that was put into place. The emergency temporary standard will remain in effect for 6 months from that July 27th date. And the standard says that it will expire within 6 months of its effective date, or upon expiration of the governor's state of emergency, or when it's superseded by a permanent standard, whichever occurs first. Just one mention about the permanent standard. It has been brought to the Safety and Health Codes Board recommending the implementation of a permanent standard. And during the 6-month period that the emergency standards in effect, the Health, Safety and Health Codes boards are considering the adoption of that permanent standard that would replace the emergency temporary standard. There's a 60-day written public comment period, and there'll be one or more public hearings to be held related to that permanent standard. And actually, we did just have one yesterday. The Safety and Health Codes Board met, and it was a public comment period. We got a lot of comments, both for and against implementation of the standard, as well as some recommendations on changes that the public would like to see if we were to go forward with that permanent standard. And last slide. One of the things that I will mention is the VOSH consultation program. This is a free service offered to all employers with less than 250 employees site-wide or less than 500 employees nationwide. Basically what this service provides is that we have consultants all over the state that can come out at the employer's request and perform a walkthrough. Right now we're doing virtual visits as well as some visits actually on site, but employer comes and walks through your site looking for any issues, specifically now with the COVID-19 exposures or any additional safety and health hazards in order to ensure compliance with all of the applicable standards. Our consultants can also provide written program help. Basically, again, we have templates available for employers to use, and your consultant can help you implement those and complete those. And then lastly, training. Our consultants can provide training not only on COVID-19, but any other applicable hazards. And again, right now we're doing these trainings virtually. If you would like to request a consultation visit or talk with one of our consultants, we do have a dedicated web page on our DOLI.virginia.gov web page. If you look under VOSH programs, it is listed as consultation. On this page is where you can download and fill out the request form and then submit that to me, and that gets sent out to the correct regional office so that a consultant can be put into contact with you. The agency has developed a coronavirus dedicated web page. You can see the address there, the coronavirus COVID-19 resources page. This is where you'll find all of the information that I talked about in the standard, the things like the template for the hazard assessment, the template for the infectious disease preparedness and response plan, as well as a PowerPoint presentation that can be used to meet the training requirements of the standard. You'll see also on there's several other PowerPoint presentations. There's a very long one which talks about, basically goes line by line through the requirements of the standard. If you are interested, it's very long, but it is a good strict reading of the standard. There's also an overview presentation on there, which is very similar to the presentation that I gave today. And the one that you want to particularly make note of is there is a requirement or a PowerPoint presentation on there provided that says medium training, and basically this meets the requirements of the standard for those medium exposure risk level employees. The training is somewhat bare bones, but the employer is able and must include things that are specific to their work site and specific controls and different measures that are in place at their site that the employees must be trained on. If you have questions specific to COVID-19 or the regulations, we do have a dedicated email address on there, COVID-19 questions@doli.virginia.gov. And this email is staffed by, is monitored by several of our staff, including myself. So you do typically get a very quick response to that. And if you do have employees that feel that they have issues in their job site or they would like to file complaints against their employer, actually, just this week, that webpage has changed. We do actually have a dedicated fillable online form, and that is front and center on our webpage, where employees can report things like if you have exposure, or if you have 3 or more cases in your workplace where employees have been infected with the virus or tested positive coronavirus. That is a requirement of the standard when you have 3 or more employees at the site, that the employer must report that not only to the Department of Labor and Industry, but also to the Department of Health. And that link on there provides that forms for you to do so, and it actually goes to both agencies since we are working cooperatively with one another. So that's all that I have. It was a very brief overview of the standard, which is 70-some pages long. I do encourage you to actually go through and read the standard, though. It's not too overwhelming if you think about it in the different areas that I've talked about today. First, there's a section that applies to all employers, and then it gets specific into the medium, high, and very high exposure risk levels. And the basic 4 elements in that are that hazard assessment, the controls that you have in place, the employee training, and then the written plan. And each of those 4 sections has is a section in the standard where you can read the specifics of the requirements of the standard. That standard is available on our webpage, again, that coronavirus resources page. You can see the text of the standard as well as all of those templates and PowerPoint presentations. And they are provided in not only English, but in several other languages as well for your employees that are non-English speaking. So I think now I will take any questions that you have.
Thank you, Jennifer. Wow, what a lot of information, and appreciate your walking us through that. We had an earlier briefing when the standard was first developed, for this industry, and Courtney Malvo was able to walk through the basics of the standard and then begin to answer some of the questions from this industry, but there were so many that we decided it would be worth asking for some industry-specific consultation, and appreciate that you've sort of answered that call for us, Jennifer. One of the things, the sort of overriding questions I might ask before we get to more specific ones. This is an industry that is very used to, compliance with a good many regulations just on a day-to-day basis, and of course are now, trying to understand and comply with the COVID-19, implications for what they need to do. I think that, it may be fair to classify that the childcare regulations and licensing inspection type things that they are complying with on a day-to-day basis are largely around the safety and protection for the children in care. And it seems to me that this standard is sort of laying over that the safety and health of the workers in the workplace. And so this is kind of some additional layering. And so, knowing the good intentions and the purposeful planning of this industry, I think understanding a little bit more about how they will be asked to comply, how will this be monitored? We'll get to some questions to help them understand where they should look for sort of the overriding requirement or encouragement. But first, can you give a sense of how the Department of Labor plans to monitor this emergency standard?
Sure. And again, you did mention that the standard is applicable to employees in the workplace, and that basically is the main goal of the Department of Labor and Industry's VOJ program, is that we enforce the regulations to protect employees both in safety and health in their workplace. So we do have just strictly that employer-employee relationship. We don't get into things like students at schools or children at childcare places or any of the public. Again, we're just strictly, our agency is tasked with looking at that employer-employee relationship. This emergency standard is enforced just like any of our other standards for any other safety or health issues. There are, again, it is codified. We have the standard number in the Virginia law, and we enforce it, just basically line by line. If your employees, if you were to be inspected by a VOC enforcement officer, and one of the issues one of the requirements in the standard was an issue in your site, potentially you could be cited for not complying with the standard. Our typical citation process looks at any violations of standard, and then looks at several different factors to determine if there will be a monetary penalty. You know, some people that have put out training so far for this COVID-19, and sometimes in the media, you will see some of those shock statements about, you know, you could be fined $13,000 if you don't have this plan in place, things like that. One thing I do want to impart on you is that those are extreme circumstances. So far, we have not had anything anywhere near that related to COVID-19 standards. And again, just our typical citation process, just to let you all know, if you have not been a part of an enforcement visit, we look at violations of standards. The employer then looks at the probability of the standard of an injury occurring because of the violation of the standard, as well as the severity of the standard. You know, does it result in death, loss of an eye, you know, whatever the hazards that the hazard could be exposed to your employees to. And then several factors are looked into reducing that initial penalty. We look at the size of the employer, any previous history with VOSH, as well as good faith efforts. And again, this is one thing that we really point out with the standard, because this is uncharted territory. You know, no one in our agency, no one in the public has ever had to deal with a pandemic of this degree. So we are factoring in that good faith effort. You know, everyone is being bombarded by requirements and guidelines and all sorts of things. And this standard, basically, the intention was to protect employees from the hazard, which, again, protecting employees is the #1 goal of our Department of Labor and Industry.
Thanks, Jennifer. That's helpful. A couple of questions now from folks who are really trying to understand if they specifically are covered through this. One attendee says I confirmed with the Department of Labor representative and through a previous Department of Labor webinar that since my family day home is singularly owned and operated, I do not fall under DOLI jurisdiction. Where could I obtain a document to provide to my insurance provider?
Again, I can confirm that because I was that DOLI representative that answered the question.
It's not sleeping, right?
Provided the webinar. And just as any of our standards do, VOSH has jurisdiction over employers with one or more employees, or more than one employee, I'm sorry, one or more employees. So if it is a singularly owned operation, it is not covered by the standard. So if you have just, you know, it's just yourself at the work site providing the daycare services, VOSH does not have jurisdiction over those work sites. As far as documentation to provide to the insurance provider, you know, I'm not sure what sort of thing this person is looking for. It is just in the general tenets of the agency is that we have that limited jurisdiction. So I'm not sure what exactly they're looking for when they ask.
And would that be maybe stated on the website, Jennifer? You know, something about, you know, businesses with more than one, or workplaces with more than one employee?
I'm not sure where that would be located, because it's not something that we really would come out and you know, make a big point of, but it is in the standards with that enacted the agency and our ability to enforce the standards. I could certainly look through there and find a specific code for that person if that's something that they needed to reference for the insurance company.
I think that would be very helpful. Thank you. And we can follow up with you on that, but I do think that would be helpful. Now, another question, are religious exempt church ministry organizations under the DOLI jurisdiction? We were advised religious facilities are not a business, but a ministry. Other organizations are not.
Any VOSH standards actually do apply to religious organizations, but with two differentiations. Any of the actual religious type activities are not covered by the standard, but those secular activities, things like childcare, are included and as under the jurisdiction of the standard.
Thank you. Let's see. We have a ton of questions about face coverings and face masks, but let me ask a couple of other questions first. When you were walking through the presentation and you talked about the assessment that should be conducted, one of our attendees asked how often should that assessment be done? And is that sort of a one-time?
It is just a one-time thing. What you're going to do is you're going to look at the typical job tasks that your employees will be doing at your work site. Anytime that you do potentially bring in another task, if your employees, have one-off tasks, or if you bring in some additional requirement for your employees to do, that potentially could change that exposure risk level. You'd want to obviously reassess and look at that, but for the most part, you're just going to have to do that one assessment.
Thank you. And then also you were mentioning the timelines and sort of the deadlines for doing the training and then development of the plan. One of our child care providers says, what if our employees did not start for the school year until the end of September? How does that affect our training dates if we're medium risk with more than 11 employees?
You would want to make sure that they go back and receive that training, because it is a requirement for all employees to have received that training on the written plan, and as well as any control measures that are in place.
All righty. And someone is wondering too, does Virginia still have the 14-day quarantine, or is it lifted?
That was one of those requirements that I talked about that came from the CDC that changed. So we are allowing employers to follow the CDC requirements, which were changed from those 14 days.
All righty. And you mentioned that there were templates for, is there a template for that assessment on your site? Is that one of the resources?
It's listed as hazard assessment, I believe, and it's just that blank Excel spreadsheet.
Okay, thank you. And I will just say, my organization is a low risk organization, but we did find enough information on the site to be able to do just, it wasn't a fancy, but a fairly informal but detailed presentation to our staff about, what the standards require, just to try to make sure that we were being transparent about what is required for us as a workplace. Let's see, the website for the training. So I think all of that, I think you've got the websites listed here on this slide where folks can find information about the trainings, the templates for the assessments and the plans. And, it takes a little bit of looking, because there is a great deal of information on the site, but it also seems pretty thorough. I think the name of the assessment that you were describing was the PPE assessment. Is that right?
Correct. Yes.
Okay. All righty. And I think just the workplaces that are not covered under this jurisdiction. Just one more affirmation from you. It's if there is one only employee in that workplace.
Correct. Self-employed. We don't have jurisdiction over that.
All right. And the signage that is required for the workplace, do you have examples on the site for that, or just the list of the items that must be included?
The list of the items that must be included is in that particular part of the standard. We do not have a template for that, just because basically that's just, those, like I mentioned, those 3 things that have to be posted at common areas. Employers can do that in any format they want to.
All right, thank you. All right, now I think a couple more questions that folks have about, you had mentioned the public comment or the process of sort of discerning whether these regulations are temporary or permanent. How can folks access a way to weigh in to that public comment?
Actually, on our webpage, it gives the details on how to submit those public comments during the public comment period. And then we also post on there the dates of, if we have any additional public comment periods, which I'm not sure specifically what dates we're looking at doing that. Like I said, we did hold one yesterday, but the agency is accepting comments from the public.
Thank you. Now let's turn to the face masks. There were a number of different questions from different, types of, lenses. I'll also invite Jenna to hop in too, because I know that many of these questions continue to crop up just in terms of the phase 3 guidance for childcare, in terms of encouragement of face masks for children 2 and up, but requirement of face masks for the adults, the staff. And questions range from what if staff refuse to wear to, how do we, make sure that we're complying, face mask differences between cloth coverings and face masks, face shields. So let me just dive in and see if we can tackle some of these. If I have an employee with a doctor's excuse to not have to wear a cloth face covering, would she be able to wear a face shield instead?
And this, I'll kind of defer the answer to the CDC. I know there's a lot of research going on right now that first they said it's effective, then they said you should wear it with face masks, and then they said it's not effective. But our standard does not cover the use of that as being an acceptable control measure.
Okay.
The face masks.
Okay, but then I think you said that if a workplace chooses to just go with the CDC.
Correct. You just have to be able to provide either us or any employee that was asking, specific guidance on the CDC guidelines. And that actually was one of the things that was brought up yesterday in the public comment period was, the potential for if a permanent standard was adopted, what kind of language would we have in there, just given the fact that the CDC guidance is changing almost on a weekly basis, and how we're going to basically expect employees to keep up with that.
And it sounds like, a good way to think about this too is for the employers to think about, concerns or questions their employees have, and how the employer can sort of clarify for staff what the regulations are, what the requirements that are being followed within that workplace.
Yes.
Okay, next, phase 3 reopenings, revised guidance stated that staff must wear cloth face masks. The slide here indicates disposable facial coverings. Please clarify.
As far as our standard and from the agency point of view, the standard does define face covering as any item normally made of cloth or various other materials with elastic bands or cloth ties that secure over the wearer's nose and mouth.
Thank you. I know that masks are required. Are they required at all times? What if someone is alone in their classroom preparing for class?
Again, you'd want to look at the exposure risk level, and this would be something up to the employer to look at. If there isn't an exposure, if they're not being exposed to employees within 6 feet or the public, then you'd have to look at reducing that job test to a lower exposure risk level. So you have to look at it again, just like you would teleworkers, for example. They're not exposed to other employees or the public in the workplace. So that could be considered by the employer as a similar process. It just really depends on what their procedure is.
And so on that note, though, Jennifer, it sounds like what I think the question is about if the individual's exposure changes during the day, depending on, the time of day or what's going on with the classroom. So, I think it's less about changing the risk status of the entire workplace, but does what happens when the risk exposure for an individual. I think what I'm hearing from what you're saying is that the general rules for the status of the workplace in terms of risk exposure doesn't change, even if individuals position within that day on that work site
No, and actually the employer, and part of that PB hazard assessment is it can either be job based, or it can be employee based, or it can be just general work environment based. But you could potentially have an employee where if they're doing one task, they would fall into the mean exposure risk, and if they're doing another task, such as working in basically an office type setting by themselves, you potentially could fall in a lower exposure risk level.
Okay. And so again, what they're going to be concerned about is what if someone comes to do a site visit and they are a medium risk business, children are, on the playground or in other classrooms, and an employee steps into an office to do some paperwork or to prepare a lesson plan and they do not have a mask on. Is that sort of citation worthy?
No, again, because basically the premise of any citations that we issue is that we have to show an exposure, and if there's no exposure, then the standard can't apply. We can't issue any citations for that.
Okay, that's super helpful. Thank you. So a couple of questions or several questions about employees with asthma. So they can't wear a face mask due to asthma. Can we require a doctor's note to support it, or how should that be handled?
That is actually listed as a frequently asked question. That's one of the things that I failed to mention on our webpage, and I'm actually going to pull that up right now. Questions like this we've been getting, more commonly as it comes out for interpretations of the standard. We are putting those up almost on a daily basis as frequently asked questions, and I'm pretty sure there's one related to that I'm going to pull up right now, related to the medical piece of it. Let's see here. And if not, what I can do is I can always look this up and get back to you on that.
Okay, thank you. But I think your answers have been really useful in sort of peeling this apart. It's a little bit of a complicated question. And then what if they're outside? Is that similar?
Again, you'd have to look at other engineering controls, things like social distancing. Can they maintain that 6 foot of clearance from the children or other employees?
Perfect, thank you. And then I know we're getting close to our close time, but we do have a good many more questions. Many of these are a repeat of some of the ones that I have pitched and that you have answered. I think also many of them sound like they could be answered with a little bit more due diligence on your website, either through the frequently asked questions or through some of the guidance provided. One of the things that I will just say again is that the recording of this session and the slides will be sent to by email later today so that folks can share with others who may not have been able to attend, or if you just want to hear the information again. Sometimes I think it's hard to take in the information during the presentation and feel like your questions are answered. Jennifer, you've been super patient with answering these many questions. Let me just see if, Jenna, before we close, anything that you want to weigh in on from seeing the questions that are coming forward or just knowing what questions are coming out of the Phase 3 revised guidance?
Thanks, Kathy, and thanks to everyone. Just want to echo my appreciation for the thoroughness of this presentation. I think the key intent of the DSS Phase 3 guidance is really to echo the DOLI regulations, right? So in the place where it says phase, but that contradicts, right? So the DOLI regulations are, we're just really, those are the hard and fast regulations relative to these Phase 3 guidelines. So that's what folks should absolutely follow. And just to note that encouraging, not requiring kids 2 and older, if they're not underlying health issues, if they're not sleeping, if they're awake and can handle their mask, encouraging them to wear them, but not requiring it. So I know it's tricky in terms of our providers needing to balance between keeping kids safe, keeping educators safe, one set is guidelines, one set is, you know, hard and fast regulations, and hopeful that today's conversation helped unpack some of those layers as described.
Thank you. I really appreciate the time that everybody's taken to be on this presentation today. Jennifer, we may ask you for a repeat performance because it's been, I can tell it's been so useful to folks, and questions are still popping up. I do want to ask folks to go to the site that Jennifer has provided here, a number of different links and website resources that are pretty specific in answering questions. It does also feel that this industry has some, you know, they're sort of complicated aspects of some of these questions. And of course, they do want to be sure that they're in compliance. But the information that you've provided, it sounds to me that, you know, they should not fear that this is sort of a gotcha thing, but it is really to make sure that we're all working as hard as we can to make sure that the workers, you know, at work sites, at workplaces, as well as the children in care are as safe as possible, safe, healthy, and receiving in a good environment. So thanks again for everybody's diligence to meeting that shared goal, and Jennifer for providing the information today. Jennifer being on, Jenna Conway also for being on to clarify some of the questions. Hope everybody has a great afternoon, and thanks again.